everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
I'm Dr. Nick Circolone. Today is that day. We're going to be talking about kids. And when I say kids, we're talking about little kids all the way up to high schoolers and, even college age, because we see a lot of children, and I say kids because, they're kids. And they all have something different, but I'm seeing a lot of sports injuries related to the games and the sports that these kids are playing. I told Quake, I said, I should go on Sport Talk and we should talk about some of these injuries that we see. There's a lot of things that go on, and sometimes, not that they're missed, but their doctors are concentrating on one thing. I'll give you a good example. I had a young girl come in today, and she's a volleyball player. She plays for she's a college volleyball player. And one of the things that I noticed, there was shoulder pain, had a lot of shoulder pain, a lot of shoulder issues. So we did an exam. I looked at it, and sure enough, she's got some shoulder problems. But you know where it's coming from? It's coming from the neck. And
really?
Yes. Oh, absolutely. And I explained to her, it's part of the brachial plexus, okay, that's in the cervical spine. And when you're playing volleyball and you're getting ready to spike the ball or lean back, you turn your head away, so you're actually stretching that brachial plexus. Good example. Did you play football in school?
Yes.
Okay. You ever have a stinger?
Oh, yeah.
Okay. Where like your arm just goes completely numb. Mm-hmm. Well, that's a brachial plexus injury. You injure that enough, it's going to cause, pain and irritation long down the road. So if you injure the brachial plexus, well, the brachial plexus supplies a lot of things. It supplies from the neck, it supplies all the upper extremity. So if you damage part of that, or if it's irritated, or if you have a cervical issue, it's going to manifest itself as a shoulder. So what happens is, over time, even though you have a shoulder injury, I'm not saying you don't have a shoulder injury, but what started that shoulder problem? That shoulder problem really started from the neck and kind of cascades down and ends up causing problems. So people they'll go in, I had rotator cuff surgery, and I'm like, well, that's good, and they still have pain. Like, why do I still have pain? I had surgery on it. I did the rehab. I did everything I needed to do. Well, we missed one of the components. Now, I am going to talk about, my counterparts that, the orthopedic surgeons, what they do is they concentrate on just the problem that is at hand. You come in, you have a shoulder problem. Yes, you have a shoulder problem. Yes, there's a rotator cuff injury. Let's just fix it. But it's never gone up the chain and go, wait a minute. What's really caused this problem? And it's the cervical spine. And that's where I think we shine the best with that. We'll evaluate patients that have these injuries, and we look for it as globally as we possibly can and say, you know what? Where did that problem come from? Where did that problem start? Did you really injure that shoulder, or do we have a cervical component that's causing it? And same thing with wrist, elbow, and things like that. I see that a lot. Not that it's being misdiagnosed, because, again, I keep saying it. I don't want people thinking that, every shoulder pain's your neck. But you have to evaluate that as well to make sure that everything is working in synergy so we don't have these pains and these injuries.
No, I totally get that. And I didn't realize that when I had a number of stingers back in the day, that's kind of where it originated.
Yeah, absolutely. And it's one of those where it's such a sensitive area. I mean, that cervical spine and that brachial plexus. But you can have a brachial plexus injury from an injection.
That is wild.
Yeah, and it happens.
That is wild.
And it happens more so than we think. Is that saying that should get a vaccine? No, that's not what I'm saying. What I'm saying is that sometimes you'll have a brachial plexus injury because of that, and it'll cause irritation and inflammation, and they just can't use it, and they have to go through PT and get things straightened out. But yeah, there's a lot that the brachial plexus does.
When you have that continuous injuries, does it worsen your stingers or whatever you may be going through?
You'll end up getting radicular pain, usually in the thumb and the forefinger and part of the middle finger. You'll get a lot of that numbness and tingling. But see, everybody thinks about the rotator cuff as being one muscle. The rotator cuff is actually several muscles. Okay, and one of the muscles that is implicated in the rotator cuff that I see a lot of that we address and we can do some trigger point therapy on that. We can do some modalities on that, E-stim, ultrasound, things like that, which will help it. And it's called the teres minor muscle. That teres minor muscle really is one that's kind of missed. It's hard to tear that muscle. I mean, you could, but it's really difficult to tear. So what happens is you work on that muscle and it's overworked, and literally you'll drop somebody to their knees while you're working on it. And it's right, if you reach underneath your armpit and reach back and touch that little bony by the scapula, you can feel how tight and tender that is, because it's one of those that's really missed. If you've ever had a massage and somebody works on it, you're like, oh, please stop, I'll give you whatever you want. I'll tell you my PIN number for my account. Just stop. There's a lot of things we get to see, Joe, which is kind of cool. I like it. I like the difference. It's like I tell patients when they come into the office, if they've ever gone to a chiropractor before, this is going to be very different. So kind of expect something different. Don't expect something that you've had before. And I've had patients, and one today said the same thing. I went to the how'd you do? Oh, yeah, I went. It was good. It was family friend. We would see them. I've been seeing them ever since I was a little kid. I go in, crack. They're out the door, and that's it. And I was like, oh, okay. I mean, that's okay. I mean, that's fine. But you're not going to get that in my office. You just don't get that. I love the fact that I like looking at things. I like clinical problems that everybody else is like, I don't know. Well, go see Circolone. Let's see what you can do. And we find something a little bit different, and we make people feel better.
So you do more than just a big bear hug.
Yeah, I don't even do the big bear hug. I mean, could you imagine going into an office? Okay, think about this. You've never been to a chiropractic office, and the guy goes, turn around, and he wraps his arms around you and lifts you off the floor. How would you go back?
Except, well, my buddy can do that.
Yeah, exactly. I mean, how many times do they do that when you're in sports? I mean, I see that all the time.
Oh, yeah. Buddies would do it, yeah.
Oh, yeah. I learned this at the chiropractor. Not at my place, you didn't learn that. It's like, I didn't go to chiropractic school to wrestle with people. I just didn't do that. It's like, I'm not going to wrestle with you. Some of these guys are big, and you got me thinking about fun. I love funny stories. Funny story. I wish this was more visual. Guys on Facebook, you can't really see it, but you can understand because you can see my hands moving and everything. But what's really funny is I had this patient. I was just an intern. I mean, we were going through our things, and I had this patient. He must have been 6'5", 285 pounds. Big dude. I mean, a big dude. And there's a move that you do where you can kind of lean the person back and kind of stretch out some of the vertebrae using the palm of your hand and things like that. Well, anyway, I leaned on this guy and he kind of falls back really fast. Well, literally came off the table, or my feet came off the floor. I landed on top of him face to face. Both my hands are behind this guy, and I'm just looking at him in the face going like, now what? And he looks at me and he goes, you okay, little man? And I went, yes, sir. He says, I can't move. And I said, neither can I. And I'm trying to get my hands out from under him. And I had to call somebody to help us get me out of this predicament that I was in. It was actually very funny. I picture that in your mind. It's like, oh, so I'm very careful about, how I do things now. You learn a lot when you're in school, but there is some funny things that do happen. But, getting back to the kids, we do see children, and a lot of times parents are like, oh, I don't want to take my kid to the chiropractor. I'm like, why? It's like my grandson gets adjusted, and let me tell you something. My daughter goes to him, are you going to adjust Nicholas tonight? Yeah. He does better attitude-wise. He does better when he sleeps after he gets adjusted. And a lot of times what happens is that cervical spine is so tight on everybody, and even kids. They're rough and tumble. I mean, my grandson break dances. It's the funniest thing. I wish I had a video of it. I need to do one. Get 5 million hits on YouTube just watching him do this. But I mean, he's just a rough and tumble kind of kid, and his neck and shoulders, they get really tight. And now he's in school and he's on his iPad. He's doing all kinds of stuff that hurts that. So when we adjust him, and people got this adjustment of this bear hug. It's really not like that. With kids, it's very different. With older people, it's very different. I'm not very aggressive anyway with that. You got to get things to move, and you got to get them to move freely without forcing anything. Forcing stuff does not help. But what happens is the brainstem comes down into the cervical spine at C1, C2, just a little bit. And when you work on that area and loosen up that area, get the muscles loosened up, get the vertebra to move freely, what happens is it's like turning a light switch on. It's just like, whoo. And I know for me, and I don't know if I've mentioned this before, but I was in a really serious car accident when I was 7 years old. I was walking across the street and a car hit me doing about 40, 50 miles an hour. Threw me up in the air, landed on my head, good thing. Landed on my head, deep pressure fracture skull, messed up. I was in the hospital for 2 months. But chronic headaches after that. And I went to a chiropractor when I was probably 19 years old. No, yeah, I was about 18. And got rid of my headaches. I didn't go for that. I went for because I hurt my back doing on a job, but ended up going him, got rid of my headaches. But now what I do know is that if I feel fatigued, if I feel a little tired, what I do is I end up getting a adjustment, and it feels like somebody turned on a light switch. I mean, I think clearer, I move clearer, I feel better, all because of that upper cervical adjustment. And I think we're doing an injustice to our injustice to everyone who doesn't really get an adjustment. And I'm not talking about, the bear hug kind of stuff. I'm talking somebody that knows what they're doing, has been doing it for a while. And once you get adjusted, you see a huge change in the way you feel after you get adjusted.
Why is that? Just a decompression of everything? Or?
Yeah, basically. Some people say it's a euphoric feeling. It's not a euphoric feeling for me. It's literally a release of tension in my cervical spine, which makes me feel better overall. Because think about this. Every single nerve that supplies your body has to come from the spinal cord. Comes from the spinal cord, comes through the spinal vertebra, and that spinal column. And what happens is, you release some of that. Real quick kind of a history. So people go, what's the difference between a DO and what's the difference between a DC? Doctor of chiropractic, doctor of osteopathic medicine. Well, back in the day, osteopathic doctors were doing the same thing that medical doctors were doing, but they had to have their own place because the AMA did not want anything to do with the DOs. But now you can't tell the difference between an MD and a DO. You go to the hospital, it could be a DO, it could be an MD. You don't know the difference unless you look at their shirt. Sometimes it just says doctor on there. Sometimes it says MD. Sometimes it says DO. Well, the DOs believed years and years and years and years ago, around the same time chiropractic came in, the DOs came in. And the DOs believed that the blood supply was the root of all disease. Okay? So if the blood that exits the spinal column, that the arteries and the veins, if there's a problem with them and there's compression of those, that's what they thought the problem was. Well, chiropractors believed that it was a nerve problem. Well, now we know that it's not a nerve problem. It's not a vascular problem. It's not a lymph problem. It's all of it. It's a complex that when you adjust this area, you're affecting all of those structures, which make people feel better. Now, I'll give you good examples. Somebody, let's say you have, we were talking about the upper extremity shoulder pain, and you have tingling into your arm. Some people feel like it's like a flow of water. Some people feel like it's a deep bone. That could either be nerve or vein or artery causing these problems, and you have to distinguish what it is. There's things of the upper extremity called thoracic outlet syndrome, which is more of a vascular problem than it is a neurological problem. You have numbness and tingling, which is a brachial plexus problem. The brachial plexus, if you looked at it, I know we're getting into this, and I wish I had like a drawing board so people would see this. But the brachial plexus not only has nerve, but it also has a vascular component that looks exactly like it. And what happens is you can affect either one of those, causing all of these problems. So, when we adjust those areas, manipulate those areas, what happens is we release that tension. But it depends on how you do it and how aggressive someone is. Because sometimes if you're too aggressive with an adjustment, you will get that euphoric feeling, and in 2 or 3 days later, you're going to have that same problem. My goal is to treat you and get you out the door. I don't want to see you 3 times a week for the next 50 years if there's no injury. You know what I mean? We're not going to do that. We're going to fix you, make you feel better, send you out the door, send more people to me, and that's how that works. But you have to figure out what's causing the problem and addressing that problem. What we usually do, we can do blood flow studies to tell if it's a blood issue, or we can do an EMG or electromyography to find out if it's a nerve problem, and then you deal with it from that point. But it's interesting, the difference between the chiropractors and the DOs. Then the DOs wanted to do more. The chiropractors said, we want to be separate and distinct. Okay, you want to be separate and distinct. So now we have chiropractors that do all kinds of different things. Nothing's consistent. So that's why a lot of MDs and DOs and other healthcare professionals don't want to refer to chiropractors because they're afraid, like, I don't know what's going to happen when you send you to this guy. Is it good or bad?
It's a mixed bag. You don't.
Yeah. So, I've been practicing 30 years here. So, we have doctors that listen to talk radio all the time. They know that I'm not this crazy man. They don't have a problem when I send them patients or when they send me patients, which is a good thing. And that's what we want to do. We want to have that kind of camaraderie. We were talking about adjustments, and we were talking about kids and adjusting kids and how important it is that we do look at our kids and get them adjusted, because they're playing sports. They're just going like crazy peoples, and they're doing it. But I've seen a lot of sports people. And, I haven't really talked about much of this, Joe, but, I was the lookouts doctor. I was with the U.S. women's rowing team. I've treated Olympic athletes, professional athletes, all through my career of all 22 years. No, I'm just kidding. I've been practicing 30 years, actually. And one of the things that I can honestly say, and I know this is going to be crazy when I say it, but we can increase performance of an athlete by working with that athlete, not just an adjustment. Okay, so if you're thinking about going to a chiropractor and you go, I'm going to a chiropractor, I'm going to get adjusted and I'll increase my performance by 20 or 30%. No, once we get the body working in synergy the way it's supposed to work, that will automatically increase your performance. And I can guarantee you that we can do that, because as a matter of fact, it was funny when I approached the lookouts back in 1993. Yeah, it was 93 when I approached them. And I said, I can improve your performance of your players. And they're like, yeah, okay, whatever. And Kreitzer was not Kreitzer. It was, I can't remember the guy that was over there at the time. Because it'll come to me. But anyway, he was the trainer, and he was like, there is no way. He says, I believe chiropractic is a great thing, but no. So what we did was I said, look, let's try it. And we did. And it was so interesting that we used to be in the dugout and look out into the locker rooms and adjust these guys in the locker rooms and with the trainers and getting them working and doing better things. And we saw a big difference. I like to work with the trainers that are with the teams, like if they're high school teams or even professional teams. I like to work with the trainers because I get to see them, I get to evaluate them, and I can tell the trainer, hey, let's work on this and let's continue through this. And I'll see them every once in a while, and we can definitely make a difference in them. So improving performance is one thing. But think about this. If you feel good, you're going to play good. You just are.
That's facts.
And if I can get you not out of pain, but performing at your optimal level, you're going to do much better. Is your diet good? Are you exercising the right way? Are you over-exercising? Are you doing too much? And I'm seeing a lot of these high school sports players, doing way, way too much that's injuring them rather than helping them decrease it's going to decrease their performance rather than improve their performance. Yes, they're going to look stronger, they're going to be stronger, but they're really not. It's like a good example. We all talk about the core. When your core is not right, you feel bad. Well, I have patients that are like ripped. They got the 9-pack abs, and I mean, it's just like over the top. That's a quiet joke. By the way.
I'll stick to my one.
Yeah. So they have the 6-pack abs, but yet their core is terrible, and their back gets hurt all the time. But they look good. And I have other patients, and I've said this before, that are heavier that have the 1-pack, and their core is pretty good. The difference is when your core is working the way it's supposed to, your balance is even going to be better. So what I try to do is I try to improve their balance, not only, of course, adjustments and, getting the trigger points and everything else taken care of, but getting their balance right is going to improve not only their core, but it will improve their performance drastically. So that's one of those things. Think about this, Joe. You played football in high school. Did you or did you not like get to the weight room, let's lift weights, and you threw weights around, but weren't sure exactly why you were throwing the weights around?
For the most part, sure. I mean, I studied bodybuilding techniques and things maybe a little bit more than the average guy back then. So I mean, I was being more specific with it, but still at that point, it was just all about throwing weights around.
Yeah, and how much weight can I curl, and
Yeah,
how much?
yeah.
I've been doing this new workout routine. It's called building a deck. I was doing this new workout routine where my weights are not heavy, but I'm doing stuff with like a ball between my legs, and I'm trying to balance a little bit more. It's called functional exercising, because what we need to do is we need to do functional things. Like I'm doing a squat with one barbell, or excuse me, dumbbell. Why am I doing it with one? Well, it's just like picking stuff up. You want to go down, you want to get that balance right, and you're switching it. And I don't know if you've ever seen a suitcase. It's called a suitcase walk, where they don't call it a walk, but they're holding a heavy weight, and you're like lunging and walking at the same time. Have you
seen that? Yes.
Okay. So what they're doing is that's a functional exercise, and that's where we really need to be. We need to be doing functional exercises rather than like single plane kind of exercises, or even double or triple plane exercises.
The simple press exercises.
Yes.
Yeah.
You want to do a walk with a squat and a shoulder press. These are things you're going to do this. How many times we bend down and we push up. These are things that we want to learn how to do, and I teach my patients how to do that. How to squat properly, how to get that balance, and because once we get that balance, once we get the synergy of the muscles, synergy of the bones, all working correctly, what happens is you feel better and your performance is better. Not only is it good for people who function with sports, but it's everyday life. I mean, if I could teach someone how to, properly use a functional exercise, they're going to be better as a gardener. They're going to be better if they're a plumber or carpenter. They're going to be better doing their job with less injury. And that's the whole point. We want to get them back into, doing the functional exercises so that they're not injuring themselves. We do a functional analysis. Now, when I say there's a functional analysis that people do when they're working to make sure that they can do certain exercises. Like if you work for, certain movements, such as if you work for Volkswagen or another place where you're doing a lot of that standing and, repetitive type stuff. You want to get something where you're functionally going to be strengthening up that area so you don't necessarily keep hurting yourself. If you're right-handed, you want to build up that left hand, because your left hand's always a stabilizer. I know with me, I stabilize with my left hand if I'm doing something. Like if I'm working in the yard, working on the deck, I'm stabilizing using that. So this has got to be just as strong as this hand. Good example of that, Joe, is when you look at somebody, and you've probably seen this, where their shoulder, one shoulder's higher than the other.
I have.
And they go, my right shoulder's so high because look at that stress I have on, or their left shoulder's so high. Look at all that stress I have on this. It's so tight. But that's not the shoulder that's the problem. It's the other shoulder that's the weak shoulder that's dropped. Not because the right side or left side is in spasm. It's because the opposite side is weak. And then we have to work on that. Same with leveling of the pelvis and things like that as well.
So that could be just anyone.
Absolutely. It's absolutely.
Your dominant hand, the other hand obviously is going to be weaker.
Right, but you when you look in the mirror, you think that your dominant side is strong, is because it's dominant. You feel like that's the one that's stressed out, but it's really the other side that's weaker, and you got to get that stronger.
It makes sense.
They'll work on the side that's higher. Same with your pelvis. Great example. If you've ever been to a chiropractor before, people say, "Well, my chiropractor said I had a short leg." Okay, do you really have a short leg? So anatomically, some people have a short leg, which means that they're born that way, or an injury, or they had surgery, and now they have an anatomical problem that maybe needs a lift or an orthotic in there. But most of the time, it's a muscle problem. You lay them on a table and it looks like one foot's shorter than one leg shorter than the other. Well, it's not because they have a short leg. It's because there's an imbalance. And once you fix that imbalance, you correct that problem, then you strengthen that problem, and they don't have the back pain that they've been having like all their life. It's that easy. Instead, you could adjust it all day long. It'll feel better for a while, but if you don't correct that problem, it's never going to get better.
Right.
And my average time with a patient is anywhere from 20, maybe depending on the patients, after we've done some stuff, it's shorter, but most of the time it's a 20-minute, we're working on it. We're doing this. We're figuring it out. Every time you come into the office, there's an exam, so I have to do that to find out what's going on and see if you're improving. If you're improving, then we have to change stuff. Then we spread things out, and go from there. But yeah, I think it's really good that, like we talked about, from kids to adults, we need to be getting adjusted. Well, guys, it's been another show in the can. We're done with this one. Having so much fun. You've been listening to Talk Radio 102.3. I'm Dr. Nick Circolone. This has been Health Chat. We love you. God bless, and we'll see you next week.